My name is sher-ree, and I work for GE Healthcare. I am a senior manager of research operations, and I have primarily two responsibilities. One is overseeing our investigator-sponsored research portfolio, and then implementing and validating our CTMS system. So for CTMS, really it's about managing our entire research portfolio. So for us, we have both sponsored research, where that's the studies that GE owns the design and the regulatory submission and the data and things like that. But we also have a big component of our business that's investigator-sponsored research. So our academic research partners, we're providing support to them. We need to be able to manage that entire portfolio. So being able to report on financials, being able to report on agreements, as well as study status and how we're tracking against our contracts with our investigator-sponsored studies is really the utility that we need to get out of our CTMS system. We are using it to really drive our business process, more so than our CRA is using it to manage the sites. For us, it was a way to gain some consistency across our project managers in terms of how are they managing their projects, and ensuring that everyone's completing the same list of tasks and activities that are aligned with our procedural requirements. It also is an opportunity for some of our other internal processes to be driven by these activity plans that sit within the system. And the other big efficiency that we've gained out of it is being able to understand what is the scope of work that we're doing. We've never been able to say, this is the number of GE-sponsored studies that we have, and this is the status, and this is where they're at in our process. We can now do that in the CTMS because we know that all of our active studies are being tracked in there. So for us, that was a big win. And Oracle's really helping us as we move into our next round of implementation, which is our investigator-sponsored studies, identifying these are the use cases that we need to make sure fit somewhere in the CTMS. And they're working with us to make sure that all that key data has a place to land in the CTMS so that on the backside, we're actually able to use CDA to get the reports that we need to send up to our leadership. The biggest benefit to the CTMS for GE is the fact that I now have one system that has all the data for our entire research portfolio. So when I get asked by our senior leadership, give me the number of contracts that we have executed, tell me how I'm tracking against this contract, what's just the number of studies that we have. I have one system that I can go to now and actually get that information confidently. So for us, that's a huge win and that's a huge efficiency gain. And from a compliance standpoint, it just makes us more compliant to be able to tell anyone that comes in, this is what we're doing. And in working with Oracle, what we've seen over the last 2.5 years is Oracle's willingness to sit down with us and understand what are our needs specifically that are different from pharma, and make sure that we're designing the system and the integrations between CDA and Inform and all the other applications meet our business needs.